Good morning, everyone, and thank you, Gaurav, for allowing me to be a part of this IC on for documentation and video documentation, etc., which is something becoming more and more important in today's era. Please switch on the room lights. So anticipant photography. So before I go into it, we need to understand why do we need to document whatever findings or whatever we see on the patient. Why do we need to do that? The reasons are, number one is for photo documentation. So this was a young male with a large fulminant ulcer following topical steroid prescribed by the general physician for his red eye, and patient's relatives were like really very apprehensive about what was happening, and I kept doing whatever treatment was required, but at the same time I made sure that I was photo documenting whatever I was seeing on the slit lamps. So this was when he came to us. As you can see, it's a very active looking ulcer with a hypopion. So we started with the corneal scraping and started the treatment. So now you see after day 2 it's looking better. Then day 4 it is looking even better. So that's what. So when the patient, of course, symptomatically is marginally better, but she was still having a red eye and was not able to see anything. So under the circumstances, these photographs go a long way to explain to the patient or to counsel or to pacify the family members that the treatment is being done and the patient is on is improving. With the clinical treatment, whatever you are doing. Second important reason for photo documentation is for preoperative counseling. So this was one lady who has a bilateral pseudophakic bullous keratopathy, and we had done a DSEC, and this is how she looked post DSEC. So whenever I have to counsel somebody for a DSEC surgery, I always make sure that I show these pre and post-op photographs. So anybody who sees that, it's very easy to counsel and them and get them converted to a surgical patient. Third point is for post-operative monitoring. Here again, this is a patient where we have done a DSEC for an aphakical, and as you all know, in DSEC the outcomes are not very great in the aphakical because the air bubble does not stay in the anterior chamber. And as expected, on the first day post-op, he did have a graft was detached from the host cornea, and I kept following him up and taking serial photographs till the gap between the donor disc and the corneal tissue became less, and this is how the patient did at 5 weeks, and this is how we did at 5 months post-op. So all these things are very useful to reassure patients and make them happy that some good things are being done to them. So coming to summarize, what are the different options that we have for slit lamp photography? We could have a slit lamp imaging system, where these are, or you can have a slit lamp with a camera and adapter, or you could have a slit lamp with a smartphone and an adapter, or a slit lamp with a video camera, and the last option is the slit lamp with a digital camera and adapter. But even though I have put it in this order, possibly when we started slit lamp photography, at least in India, I think we started in the reverse order. That is, we initially started doing it with the digital camera and the adapter, and then gradually the different systems have evolved. So starting with the first system is the slit lamp imaging system. Like this is a proper system which comes to you from the company. There's nothing else you need to do that. Okay, so here you will have a good quality slit lamp. Along with that, you will have the camera which is integrated. It is nothing that you need to fix or add or do some adapter or something like that. So it comes built in like that, and it also comes with an archival system so that you can serially record and archive the photographs for monitoring, like patient counseling, etc. So this is a routine slit lamp with integrated camera. It also has a computer screen in which you can see the photographs, and it will have an inbuilt software for data storage and archiving. So this is what I would label as the gold standard as far as the slit lamp photography is concerned, because it's completely on its own. You don't need to do anything else to make it functional. And this is what we currently use in one of our OPD rooms. This is from the Topcon company, and this is not, I don't have any financial interest with this. This is a DC3 camera which is integrated with a proper good quality Topcon slit lamp, and I can take still images as well as videos. I could record those, I can archive those, and I can even in a serial order, I could see the pictures like the day of presentation, 2 days, 3 days, 6 months. And that way also I can very serially archive them. Now, the reason I'm stressing so much on the archival system is that it is very, very critical for when you are trying to present anything. So if your data is not at the same place and organized right from the beginning, the night before when you are making a PowerPoint presentation, it becomes very, very difficult to really collect all your data, which is like if it is scattered from here, there, everywhere, and in the end you don't have the data the way you want it to be. So it has to be such that on a one finger click you get all the photographs there together, so that you can just pick and choose whichever you want and put for your PowerPoint. So it has to be very, very user friendly. If you do not get the pictures which you have very meticulously taken photographs and kept, then there is no point if you cannot use them for your presentations or for whatever purpose you need them to. So the system has to be very user friendly as well. So these are some of the photographs, some of the systems which are available. They are from Huxray, Topcon, from the even Akpasani has, the CSO has. There are multiple options which are there. Possibly the only drawback here, if I say in the Indian scenario, would be the cost. It's a little bit higher on the higher side as far as the cloud photography system is concerned. But yes, definitely it is definitely something which is worth it. And we should all, if we have the we can go for it. Then this is what you should go for, because it removes all possible kind of headaches. And this system will usually come with a diffuser for take a diffuse image, as you can see on the left side, or you could also take a slit image, as you can see on the right. And it can be used similar to how you use a slit lamp, the various illuminations of how a slit lamp is. Now coming to the other system, this is very getting more and more common nowadays, is with the smartphone and adapter. This is just one of the companies, again no financial interest. So here I'm just put up the photographs to show how it works. As you can see here, there's a slit lamp on the right. I don't have a pointer somehow. So there's a slit lamp on the right, to which there is an adapter, and there's a smartphone which is fixed to the adapter here, so you could take photographs. And there are multiple number of systems, there are multiple companies who are doing this. And this is possibly the first prototype as far as India is concerned, which was designed by Dr. Fogla when he made a certain designer, the adapter with some stuff which is readily available at home, and he fixed up his iPhone 4 and got brilliant pictures. And henceforth, there are multiple companies which are doing this. There's Dr. Modi also here in the audience. He could also help you out if anybody is interested. Coming to the third pattern is the slit lamp with an integrated video camera. We use this system as well in one of our OPD rooms. This is an SL115 slit lamp from Zeiss with a video camera attached to it. The beauty of this system is that once you switched on the camera and the monitor, whatever the doctor is seeing in the patient's eye is being projected on the screen, and the patient can't see though, the patient's relatives can see whatever is there. So it's again very useful for patient counseling, although you cannot record the images. This is the third system with the slit lamp with the digital camera and adapter. Like I said, this is where we had possibly started with Nikon cameras and the adapters, and these are of course nowadays not very commonly used because digital camera per se is getting less and less common. To summarize, anti-segment photography system is essential in today's era, and multiple options are available, so you need to look into the things like cost effectivity, user friendly, and a very good archival system. Thank you so much.